Assalamualaikum and hi everyone. We are from group 4 for subject psychology and we're going to present about schizophrenia, the basic knowledge that everyone should know.
Hi all, today we are going to talk about mental health condition that is often misunderstood and surrounded by stigma. The condition is called schizophrenia. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and behaves. It can involve symptoms such as hallucination, delusion, disorganized speech, and difficulties with concentration and motivation. In Malaysia, mental health issues including schizophrenia are becoming more recognized especially in recent years. According to National Health and Mobility Survey (NHMS), the prevalence of mental health problems among adults and youth has been increasing. Schizophrenia is one of the more served conditions treated in psychiatric hospitals across the country. Unfortunately, there is still a lack of awareness, and many people affected by this disorder face stigma and delay in getting the help they need. It is important to understand the basic facts about schizophrenia, including its symptoms, possible cause, and treatment option. This knowledge can help reduce fear, promote early intervention, and encourage more support for those affected. Mental health awareness is crucial in a society like ours, where the topic is still not widely discussed. Next, I'm going to talk about the type of schizophrenia. Schizophrenia has historically been divided into several subtypes based on the predominant symptom. The first one called paranoid schizophrenia. Paranoid schizophrenia is marked by strong delusion and auditory hallucination, often involving themes of persecution or grandeur, while thinking and emotion remain relatively intact. The second type, called disorganized schizophrenia, also known as hebephrenic schizophrenia, is categorized by disorganized speech, erratic behavior, and inappropriate or flat emotional response. The third one is called catatonic schizophrenia, which involves disturbance in movement ranging from complete immobility to excessive purposeless activity and may include mimicking behavior such as echolalia and echopraxia. The fourth one is called undifferentiated schizophrenia. Undifferentiated schizophrenia is diagnosed when symptoms are present but do not clearly fit into any specific subtype. Finally, residual schizophrenia refer to case where the more intense symptoms like hallucination or delusion have subsided, but negative symptoms such as social withdrawal and lack of motivation persist. Although these subtypes are no longer used in modern diagnostic systems like the DSM-5, they remain useful for understanding the diverse ways schizophrenia can present. Let's move to the next topic, which is significance of schizophrenia. Schizophrenia is a serious mental disorder that holds significant importance due to its wide-ranging impact on individual, families, and society. It affects approximately 1% of the global population and typically begin in early adulthood, often leading to chronic disability. The condition severely impairs a person's ability to think clearly, manage emotion, and function in daily life. Schizophrenia also places a heavy burden on families and caregivers and contribute to high healthcare costs and loss of productivity. People with schizophrenia are at increased risk of physical health problems and have a much higher risk of suicide, with life expectancy reduced by 10 to 20 years. Social stigma and discrimination further isolate individuals, making recovery more difficult. Understanding and addressing schizophrenia is crucial for improving mental health services, promoting early intervention, and supporting those affected in leading more stable and fulfilling life.
Assalamualaikum. I'm Amar, and I'm going to present my part of the slide, which is the symptoms of schizophrenia. There are three categories. The first one is the positive symptoms, which are psychotic behavior that's not seen in healthy people. Uh, Most of these are quite common in today's society, I guess. And the first one is hallucination, which is commonly something like you see something, you see or hear voices that are not there. The second one is delusions, which are strongly believe that you think that it's not realistic. That's like different from reality. Example is like believing in someone being controlled by some special power of some sort. Um, Next is disorganized thinking, which is more correlated to speech. This examples is like you having a hard time organizing thoughts, and which would lead to you messed up your speech, which made you feel, or rather talk in a rather nonsensical way. Uh, the last one for positive symptoms are disorganized and or abnormal motor behavior. This can be included such as unpredictable agitation, like someone that just couldn't sit down properly, or inappropriate responses, or could also be associated with complete lack of movement. The next that we have is negative symptoms, which are disruption to normal emotions behavior. These symptoms reflect a loss of ability to function normally. The first example is flat affect, which shows little to no expression through emotions by facial expression, lack of voice tone, or gesture. The other one, and another one is avolition, which is lack of motivation or initiative to engage in purposeful activity, such as like you don't want to someone that don't want to go do work physical, or just not wanting to talk to other people, like they're really lack the motivation to do that. Another one is adhedonia, sorry, which is the reduced ability to experience pleasure. They're basically numb to stimuli, I guess, something like that. And last one is alogia, which is minimal speech output or poverty of speech. They basically just don't talk as much, because usually when they talk, it's because something that they can't see or such. Last one is the cognitive symptoms. These affect the patient's memory and thinking processes, and are often more subtle but much more disabling. For example, one of them is poor executive functioning, which which they have difficult in understanding information and to make decision of their own decision. Another one is problem with attention, which is trouble focusing or paying attention for long period of time. And lastly is working memory issues. They hardly remember anything that they learned recently, or just having the hard time not remembering that they were actually supposed to remember things, basically. So yeah, that's all from me. Thank you.
Treatment for schizophrenia typically involves a combination of medication, therapy, and self-management. Antipsychotic medication are a cornerstone of treatment, often used in conjunction for psychosocial therapies like cognitive behavior therapy, which is the first step in the therapy part. CBT is essential to help individuals to identify the change, the negative change, cognitive and behavior related to their condition. Physiotherapy is significant to provide a safe space to explore emotion, develop coping strategies, and improve overall well-being. CET, which is Cognitive Enhancement Therapy, focus on improving cognitive function like attention, memory, and organization. Family therapy is important because individuals always need emotional support from their families. Family therapy consists of help family understand the schizophrenia and develop strategy to support the individual because our family is the closest one to us. That is self-management. Self-management is the thing that the patient need to learn and to master to make sure that they can go through their life normally like others. First of all, they need the life skill training, which is to develop skill for independent living such as maintenance, employment, and personal care. The next is support group. This is to provide a safe space for individuals with schizophrenia to connect with others, share experience, and learn from each other. Because we know that schizophrenia is not like a newly disease, but it is a long term and is already normalized in our society. Alright, the next step that also important, but maybe not people actually care about it, which is healthy lifestyle choices that consist of the food we consume, the lifestyle, stress management technique. Because if we eat properly, we happy, and if we happy, we do the lifestyle that we love. If we do the lifestyle we love, and we manage our stress properly. Alright, the other treatment like ECT, which is electroconvulsive therapy, is for the individual that cannot respond toward other treatment. Like I said, like the previously treatment cannot effect or cannot give a good result for the patient. So this kind of therapy is needed. Next is the supported housing and employment. It's like assistant with housing and employment to help individual achieve independence. We know that schizophrenia patient will having a struggle to get their own job and their own houses, because we know many people think that they could not independently to survive on their own. So that if we provide assistance to housing and employment, this could help them to be independent individually. That's all.
Now I will talk about causes of schizophrenia. Supposedly there is no one reason of how schizophrenia can happen, but experts conclude that schizophrenia can happen due to multiple reasons, and here I point the three main reasons that I got, which is the first point, imbalances in chemical signals at your brain used for cell-to-cell communication, where this occurrence of the symptoms reflect the interplay of the neuron transmitter, especially dopamine, in the frontal, temporal, and mesostriatal brain regions. This neuron transmitter release and production is the target of current medical management. Second, brain development problem before birth, which result from in genetic mutation or predisposition, where inherited genes will affect brain structure and neuron transmitter system. Exposure to infection during pregnancy can also and also complication during pregnancy or delivery that reduce oxygen supply to the baby's brain can also increase the risk of the baby to get the schizophrenia. The third point is the loss of connection between different areas of your brain, such as the prefrontal cortex, which is responsible for thinking, planning, and decision making, often has reduced connectivity, especially with hippocampus, that responsible for our memory.
then thalamus for sensory relay, and amygdala for our emotion. Thalamus is like the brain's relay center in schizophrenia. It doesn't relay information properly to the prefrontal cortex and other areas. This affects attention, sensory filtering, and reality perception, while hippocampus, in the other hand, will affect the frontal lobe, and the disruption here affects our memory, learning, and contributes to hallucination or delusion. Now I will talk about risk factor, which refer to something that increases the chances of person to experience something, especially a certain type of disease. Okay, for the first risk factor for the schizophrenia, there is an environment, which means that environment also play the role of developing the schizophrenia in you, because many factors in the world around you can increase your risk of developing schizophrenia, such as being born during the winter, which increase your risk slightly. Then there is a certain illnesses that affect your brain, including infections and autoimmune disease, where your immune system will attack parts of your body, and this will increase your risk. Then extreme stress for long periods can also play a role in developing the schizophrenia in you. Now the second point is the development and birth circumstances, which show how you develop before you were born, plays a role in schizophrenia. The risk of having a schizophrenia goes up if your mother had a gestational diabetes, preeclampsia, and malnutrition or a vitamin D deficiency while pregnant with you. This risk will increase if you're underweight at the birth, or if there were complications during your birth, like you were born via an emergency cesarean section. The third point is recreational drug use, where schizophrenia is linked with the use of certain recreational drugs, especially in a larger amounts and earlier in life. The connection between heavy marijuana or cannabis use as a teenager is one of the best studied of these links, but experts aren't sure if marijuana use is a direct cause of schizophrenia or if it's just a contributing factor.
Hi, my name is Amir Hakim. I'm from Group 4, course KPP. I will talk about the impact of schizophrenia. First will be social isolation. Social isolation is people may withdraw from others due to the paranoia, fear, or confusion. Second will be difficulty of maintaining a job. Maintaining a job is hard because having trouble focusing and unusual habits. Third will be emotional distress. People with schizophrenia will experience anxiety, depression, and hopelessness. Fourth will be functional impairments. Basic tasks will be hard for them, such as taking care of their hygiene, managing money, will become very difficult for them. Fifth will be stigma and discrimination. They will face social stigma that will lead to them rejection and fewer supports for any opportunities. An example of this impact will be about John. John is a 25-year-old university student. Believed that classmates were spying on him through hidden cameras. He then isolated him and stopped attending classes. He only spoke to himself and neglected hygiene. And then he is diagnosed with schizophrenia. To improve his condition, he needs medication and therapy, but still will face many challenges in daily life. Schizophrenia also significantly affects social and emotional and functionality in life. Such as in real life example, John has shown that early intervention can help us avoid this predicament. And also, support and awareness and treatment are essential for recovery. That's all.